Today we'll be having the type of lecture in this class, and we will be discussing in detail about the different type of letter. To begin with the referral load, we can see that in a referral letter, we would have, you can say we do have different types of letter, such as we can say a referral with diagnosis and without diagnosis, right? We can write it down, referral without diagnosis and without diagnosis, right? We can also have this thing. You can also see that you have with diagnosis, it's a simple case, like we can just write it down the diagnosis as it is in front of you. So without diagnosis also can be discussed over here. So if we don't have the diagnosis being given, such as the symptoms, right? If we do have a symptom given, we can write it down, the symptoms as it is, or if it's a situational letter, we may have to write it down in that format. So you can see that there are different types of even referral letter, not directly being mentioned, but you can see after reading the notes that this is what type of letter it is, although it's a simple referral note that would be written at the end of the letter writing. So let's say, for the sake of example, if the patient presented to you with 3-1 history of lethargy, blood VN, and his blood investigation confirmed this sugar level, but they had not made the diagnosis of diabetes mellitus. So we are not supposed to write it down from ourselves that this is diabetes if it's not in the case notes, right? So as a matter of fact, you can see important thing is that you must understand the main concern should be written in the introduction. As you can see in here, he presented to me with 3-week history of lethargy, decreased VN, and his recent blood investigation showed high blood sugar values, right? So in that way, you can write it down simply the presenting complaint or the symptom or the situation in the introduction part, right? Afterward, we do have the differential diagnosis. In case if we are writing a letter, if it's a differential diagnosis, although the DDs are less popular in nursing, it's more popular in medicine. We'll discuss them as well. In the differential diagnosis, either we do have two differential being given, right? In this case, either we have two differential being given, so we can write it down, those all differential either in the introduction or maybe the presenting symptoms in the introduction part. So we can see there, we just have to write it down, like I'm writing to refer Mr. Alex, whose sign and symptom are suggestive of an early bowel obstruction, secondary diverticulitis or carcinoma, for a definitive diagnosis and further management. So as a matter of fact, you can see there that we do have to write it down, the thing as it is in the introduction part in the differential letter, or we may have to write it down the symptoms directly. There is a second example, if there is a patient who is having some pulmonary condition along with the cardiac condition, so we can simply write it down the symptoms or those condition directly in the introduction part. So in the differential diagnosis, you can see that we may have two or more than two diagnoses. So accordingly, you have to write it down, the information. For the sake of example, if we have more than 3, 4, or 5 diagnoses, you can simply write it down. I'm going to refer Mr. X, whose symptoms are suggestive of or presented today with auditory hallucination, linear thoughts, and he feels full up. So this is the way we can write it down, just the symptoms in the introduction part, right? So this is a letter of referral with differential diagnosis. Letter of discharge in a conventional format, either it's a nursing or a medicine letter. The simple thing will be that the ward, rehab, and discharge plan would be there in case of medicine surgical discharge. And in case of medicine, you can see that we have hospital stay, nursing arrangement, and discharge plan. So you can see that in case of medicine, like the doctors, there is no need of writing social past medical history or family history, right? There is no need of writing social history, family history, or past medical history. However, in case of nursing letter, this information could be important as per the task. Still, we might not be writing down significantly right after the introduction part. So if you have a ward stay, generically speaking, ward stay is something that is always less important. It does not mean that you have to omit something important, but it do mean that you have to give a concise and overview of the ward stay, a pictorial view of the ward stay, a brief line of the ward stay, a tagline of the ward stay, you can say in that manner, followed by the rehabilitation. As a matter of fact, the purpose of the rehabilitation would be mostly in the improvement of the mobility or whatever it is. So we have to give again a tagline or the baseline of the rehabilitation, that how rehabilitation program has helped the patient to become gradually independent. And the discharge plan, whatever it is, and whoever is writing the letter, we have to see that in the discharge plan, we should include all the significant information. Important thing is that never ever miss something that is significant, such as sometimes we have seen the students, they do miss about the, let's say the dosage of the medication, the frequency. No, it's not the case that you should miss something significant information in the discharge plan if it is written over there, even if it's the potency, frequency, or the dosage of the medicine, right? So discharge plan is significantly important, right? So in a conventional letter of discharge, we have to follow the given sequence, as you can see in front of you over here, in when expanding the notes. So ward stay and rehab should be summarized, and discharge plan should be expanded. So before we can proceed, we do have another type of letter that is called the letter of request. We can see that there might be a slight difference in your introduction. And even if you being a doctor, you can get this letter as well. But normally, there is a diagnosed case who you have been handling the patient for the couple of years, and now the patient has had uncontrolled that particular condition, such as diabetes or hypertension. So we are referring this letter to the GP for full cardiac assessment. So it's a kind of letter that we do already know the diagnosis. You just need to write it down for the further assessment. In that case, whatever the situation is, you have to write it down simply and categorically in the introduction part. Then we have the case 2. In case 2, we can see that again, the same condition, we do have another letter writing to our emergency doctor for urgent assessment and management of pericarditis. So we can see we do have to write it down that thing as it is in the introduction part, right? Because the diagnosis is being established, it's the worsening of the condition we are referring for. In case of nursing, mostly if we have a letter of referral where there is no diagnosis being mentioned, either we do have a presenting complaints or the situations that has to be explained in the introduction part. So you can see there in their letter, we have a patient who presented to you with the chest pain, with high elevated blood pressure, that need you to refer the patient on an immediate basis to the emergency department, right, via ambulance transfer. So it's a kind of emergency letter. There is no diagnosis being established. You just have a chest pain and high elevated blood pressure. With reference to that or regard to that, we are referring this patient to the hospital via ambulance. Despite the fact it's kind of emergency letter, but still we are not supposed to make any assessment, right? Because there was no assessment being made in this letter. So we can simply write it down, the presenting symptom in the introduction part. We have another letter that's without diagnosis, and it could be a common in the medicine as well, that we have to explain the situation. It's not the diagnosis itself, but it's the situation that you have to explain. There is a patient, in this case, who is having some psychological issues, and the patient was quite attached with his father, and we just need to take the expertise of the psychologist so that he can give insight into the patient case, whether it is something related to underlying grief or the psychological problem. So there is no confirmed diagnosis being made, but you just have the assessment or the symptom being given or the situation. Discharge letter we already discussed. So let's say that in kind of discharge letter for nursing, we have a patient who underwent some surgical procedure and he was recovering well from the hospital. And now we are discharging this letter to the community nurse with the following guideline. It's a simple letter because the post-op management will be for this surgical post-op management. So it's a simple format and can say it's a conventional letter of discharge. So in the category of request letter, where we had the slide before in the medicine, so it will be same for medicine and nursing now. So being a letter of request, being a letter of request, we are writing this letter to the nursing assistants post-discharge. We are writing this letter to the nursing assistants post-discharge. Right? So in this case, you can see that it would be written to the nursing assistants for the management of something. It's a letter that we are writing to the mother craft nurse. Mother craft nurse is responsible. In such scenario, when the patient is reluctant for feeding, so we need assistance from the mother craft nurse who will be looking after to the toddlers with these management, right? Hello? Right? Secondly, and importantly, is to see here we have the patient who is just born and we need full-time assistance for a mother craft from a mother craft nurse who will be looking after these kids. So this is the kind of request letter anyone who would be writing this letter. Okay. So afterward, we have the letter of discharge that is in unconventional category. Post-discharge, we are writing this letter to a social worker. Here you can see that is in category will be different. In this letter of discharge, it's an unconventional letter of discharge. We are writing this letter post-discharge to a social worker. There's a patient who had undergone this CABG surgery, and we do have a discharge plan being given. But important thing is that we are not writing for this discharge plan. We just need to take the assistance from the social worker. And what is the assistance that is being required? The assistance is that he can help the patient to resume normal life, right? He can help the patient to resume the normal life. This is the assistance that is being required by the healthcare practitioner. So here you can see that we are writing this letter to the social worker for the smooth transition of this patient back to the normal life. So important thing will be patient profession in this letter. Important thing will be like any socioeconomic details. So even you can see when you will be planning this letter referral, so what would you do? You will bring the social aspect of the letter up above. We might not be writing this letter in this way. I'm writing to request you your social services for Mr. Nasir. Oh, sorry, we will not writing this way. I'm writing regarding Mr. XYZ who has undergone successful surgery for your social expertise. So it's not the case that we will be writing for. We have to write it down, this information, in that way as it has been written in front of you. I'm writing to request your social services, right? I'm writing to request your social services for Mr. Nasir in order to help him resume normal life since he has been discharged after successful CABG. Right? So you can see there, we have the letter of request in a discharge category, but in this way, it's a kind of, you can say conventionally speaking, it's a kind of the referral letter. We need the assistance for the social worker to help the patient to resume his normal life. We can see that transfer to the hospice care. In this letter, when we are writing this letter to the hospice care, we have different things. There's a patient who is terminally ill and with a low prognosis. And we are referring this patient to the director of hospice care, and we need his assistance, right? We need his assistance. So similarly, we can simply write it down. I'm writing on the advice of social worker regarding whatever the patient name, a terminally ill patient who has been under our care for the treatment of cancer, right? So we can simply write it down, that thing in the introduction part. I'm writing on the advice of social worker, let's say, a terminally ill patient who has been under our care for treatment of cancer, and she would require a place in your hospice care. That can be written in the introduction part. Then we have a letter that we are writing to a dietitian for a dietary advice. So you can see it's a simple letter out of profession, but we are writing to a dietitian. The things that will be related to the diet, we may have to write it down in this letter. That is related to the dietitian. We have to write it down, that particular thing over here. So you can see simply, there might be a patient who had this surgery, and after this surgery, we need this, we can say coronary artery bypass, whatever it is, for post-op recovery, and there's a guideline for low-fat diet, right? And healthy simple recipes that he can have. So we have to focus on that aspect of the writing task, because we need the dietitian advice for the diet. So focus on the diet related thing. Similarly, this is another letter of request, you can say, but in a category of transfer. When we are transferring the patient from the ward to the old age homes, or from the home to the old age home, in this category, we need the healthcare assessment team first, or the age care assessment team, to assess the patient requirement that would be required while his stay in the hospital. So it's a kind of letter of request. It's a kind of letter of request actually that we are writing for the assistance, right? So I'm writing the request, age care assistance for Mr. XYZ, who is recovering from the malignant melanoma in his left shoulder. So it's again your letter of request, right? In this letter of request, we have to see that whatever it is, we have to follow that particular request. If we are writing this letter of request, so we have to focus on the main concern. Here, the lifestyle, the patient ongoing medicine, or recovery phase of multiple myeloma is very important, right? Afterward, we have the request to the pension age care patient. In this case, when we are referring for, we can see there, it's something we have to see that patient is financially broken, and for that we need the help from the patient. For that reason, we are writing to the pension care to release the pension, right? In this case, the patient was wet, and we are writing this letter to the Department of Veteran Affairs, right? The patient was wet, and we are writing this letter to the Department of the Veteran Affairs. So in this case, if we are writing this letter to the Department of Veteran Affairs, and we are requesting to assess the patient and their requirement, or any other assistance that is being required, right? So we can see, we can simply write it down. In this way, I'm writing to request a home visit by the Department of Veteran Affairs. We write in full forms to Mr. And his J. Middleton and his wife to assess their eligibility for the Department of Veteran Affairs pension, or any other assistance that is being required. Right? So this is a letter of request to the pension care. We have to write it down in this way. Followed by the transfer letter. In the category of transfer, it's a letter where we have to write it down from low to high stream, or from high to low stream, or side to mainstream. We can see that it's a kind of letter where there is a transport involved. It's a kind of letter where we have the transport involved in there. Right? It's a kind of letter. We have the transport involved. So from high to low facility, right? Or transfer to the hospice care, transfer to the nursing home, or from GP to GP, from one nursing home to the second nursing home. It's your transfer letter. It's again kind of referral, but you have to pay focus on the concerning point, the reason of transfer. You have to put focus on there. We can also have the letter of education, such as outbreak of chickenpox or any other medical condition that need to be educated by the society. So you can see in this category. And similarly, we have the letter of what I can say information. We might be writing to the ministry actually, the letter of information over here, right? So these are different types of letter. So